Ever wondered why a perfectly healthy heart sometimes dances to its own erratic beat? Well, the heart, that tireless workhorse nestled inside our chest, is a marvel of biological engineering. Its primary role is to pump blood throughout the body, supplying oxygen and nutrients to our cells. To do this efficiently, it needs a regular and steady rhythm. This rhythm, or heartbeat, is produced by a fascinating interplay of electrical signals within the heart. Like a well-rehearsed orchestra, each component of the heart works in harmony to generate this rhythmic beat. However, just as a single off note can disrupt an entire symphony, any slight aberration in this electrical signaling can lead to irregularities in the heart's rhythm. These irregularities, known as arrhythmias, can make the heartbeat too fast, too slow, or with an uneven rhythm. Why is a regular heartbeat so essential? A steady rhythm ensures that blood is efficiently pumped throughout the body. When the rhythm is disrupted, the heart may not be able to pump blood effectively. This can lead to a variety of health problems, ranging from fatigue and fainting to life-threatening conditions such as stroke or heart failure. Arrhythmias are more common than you might think. They can occur in healthy hearts and become a serious concern when they persist or if the heart is diseased. Some people live with arrhythmias for years without experiencing any symptoms, while others feel as though their heart is racing or fluttering. Often, it's a distressing sensation that something just isn't right. Heart rhythm disorders or arrhythmias can make the heart race, flutter, or even skip a beat. But what exactly causes these irregularities? Let's delve deeper. There are several types of heart rhythm disorders, each with its unique characteristics and causes. Starting with tachycardia, this condition is characterized by a heart rate that's faster than normal. When at rest, an adult's heart usually beats around 60 to 100 times per minute. If you have tachycardia, the heart rate is fast, exceeding 100 beats per minute. Tachycardia can disrupt normal heart function and increase the risk of stroke, sudden cardiac arrest, or death. On the other end of the spectrum, we have bradycardia. Bradycardia is when the heart rate is slower than normal, less than 60 beats per minute. Despite the slower pace, bradycardia isn't always a sign of trouble. In fact, well-trained athletes often have heart rates lower than 60 beats per minute, and it doesn't pose a risk to their health. However, in certain cases, bradycardia can disrupt the heart's ability to pump enough oxygen-rich blood to the body, leading to fatigue, dizziness, or fainting spells. Next, we have atrial fibrillation, the most common type of serious arrhythmia. In atrial fibrillation, the heart's two upper chambers, known as the atria, beat chaotically and irregularly, out of coordination with the two lower chambers, or the ventricles. This can lead to blood pooling in the atria, increasing the risk of clot formation, which can result in a stroke. Another type of arrhythmia is atrial flutter. It's similar to atrial fibrillation but less chaotic and disorganized. The heart's atria beat extra fast but in a regular rhythm. This can still lead to serious complications, such as heart failure or stroke, especially if not properly managed. Lastly, we have ventricular arrhythmias. These originate in the heart's lower chambers, the ventricles. They are the most serious of arrhythmias and can lead to sudden cardiac death if not treated immediately. Ventricular tachycardia is a rapid, regular heart rate that may lead to ventricular fibrillation, a rapid, irregular heart rate. In this state, the ventricles quiver uselessly instead of pumping blood, causing a cardiac arrest. Each of these disorders can present with different symptoms, including palpitations, shortness of breath, dizziness, or fainting. Some may not even show symptoms until a complication arises. The causes can also vary, ranging from heart disease, high blood pressure, to certain medications. While some heart rhythm disorders may be harmless, others can be life-threatening. Early detection and treatment are key. Understanding these types of heart rhythm disorders is the first step towards recognizing their signs and seeking timely medical intervention. The causes of heart rhythm disorders are as varied as the disorders themselves. One major cause is heart disease. This broad term encompasses conditions such as coronary artery disease, heart valve disease, and heart infections. These conditions can interfere with the heart's electrical system, leading to abnormal heart rhythms. High blood pressure or hypertension is another common cause. Over time, high blood pressure can cause your heart to enlarge or stiffen, which can disrupt the normal electrical signals that coordinate your heartbeats. Diabetes is also a key player in causing heart rhythm disorders. High levels of glucose in the blood can damage nerves and blood vessels, including those that regulate heart rhythm. This damage can lead to conditions like atrial fibrillation, a common type of heart rhythm disorder. Certain medications can also impact heart rhythm. These include some types of antidepressants, beta blockers, and even over-the-counter cold and allergy medications. If you're taking any of these, it's crucial to discuss potential side effects with your healthcare provider. Now let's pivot to the symptoms of heart rhythm disorders. These can be as subtle as a fluttering in your chest or as dramatic as a racing heartbeat. You may experience palpitations, a feeling that your heart is skipping a beat, beating too fast, or pounding too hard. Dizziness is another common symptom. This can manifest as a lightheaded feeling, a sensation of spinning, or even a sudden loss of balance. Shortness of breath can also occur, especially during physical activity or when you're lying down. Finally, chest pain is a key symptom to watch out for. This can range from mild discomfort to severe pain. It's important to note that chest pain can be a sign of a heart attack, which is a medical emergency. If you experience chest pain, seek medical attention immediately. Understanding the causes and symptoms of heart rhythm disorders can help you recognize a potential problem early and seek treatment promptly. Diagnosing a heart rhythm disorder usually involves a series of tests and procedures. So let's delve into this process. The first step is usually a physical examination. This can provide clues about your overall health and help your doctor determine if your symptoms might be related to a heart rhythm disorder. Your doctor will listen to your heart, check your pulse and blood pressure, and may also look for signs of other conditions that could be affecting your heart. Next, we have the electrocardiogram, commonly known as the ECG or EKG. This test records the electrical signals in your heart. It's a quick and painless procedure that can help identify irregularities in your heart's rhythm and structure. An ECG can show if your heart is beating too fast, too slow, or not in a regular rhythm. Then there's Holter monitoring. If your heart rhythm disorder doesn't show up during an ECG, your doctor may recommend a Holter monitor. This device records your heart's activity for 24 hours or longer. You will wear it as you go about your daily activities, providing a longer snapshot of your heart's function. Finally, there's the echocardiogram. This test uses sound waves to create detailed images of your heart's structure and function. An echocardiogram can help your doctor see if your heart's chambers or valves are damaged, which could be causing your rhythm disorder. Diagnosing heart rhythm disorders is a critical step in determining the most effective treatment plan. Each of these tests provides valuable information that can help your doctor understand what's going on with your heart. They can identify the type of rhythm disorder, its severity, and any underlying conditions that might be contributing to it. Remember, heart rhythm disorders are complex conditions that require a thorough and accurate diagnosis. But with modern technology and the right medical expertise, these disorders can be effectively managed. With modern technology, doctors can accurately diagnose heart rhythm disorders and develop a treatment plan tailored to each patient's specific needs. Treatment for heart rhythm disorders can range from lifestyle changes to medications to surgical interventions. A heart rhythm disorder, or arrhythmia, is a condition where the heart beats too quickly, too slowly, or irregularly. The primary goal of treatment is to restore a regular heart rhythm, prevent stroke, and improve the patient's quality of life. Let's start with lifestyle modifications. These changes can significantly impact the heart's rhythm, especially in early or mild cases. They include regular exercise, a heart-healthy diet, maintaining a healthy weight, limiting alcohol and caffeine, quitting smoking, and managing stress. These changes can help improve the overall cardiovascular health and often form the foundation of any treatment plan. Next, we have medications. Various drugs can help control heart rhythm disorders. Beta blockers, for instance, slow down the heart rate and reduce the heart's workload. Calcium channel blockers also slow the heart rate and can help control arrhythmias. Antiarrhythmic drugs can correct irregular heart rhythms. Blood thinners are often used to prevent blood clots, which are a common complication of certain types of arrhythmias. The choice of medication depends on the specific type of arrhythmia, the patient's overall health, and other factors. For some patients, a procedure called cardioversion might be necessary. This involves delivering a controlled electric shock to the heart, which can reset the heart's rhythm and restore normal function. It can be performed in a hospital or outpatient setting and is often used for arrhythmias like atrial fibrillation or atrial flutter. Another treatment option is catheter ablation. In this procedure, a catheter is threaded through the blood vessels to the heart. The tip of the catheter emits radiofrequency energy that creates small scars in the heart tissue, which can stop abnormal electrical signals and restore a normal heart rhythm. This procedure is typically used for arrhythmias that don't respond to medications. Finally, for some patients, implantable devices might be the best option. These include pacemakers, which regulate the heart rate, and implantable cardioverter defibrillators, which can detect dangerous arrhythmias and deliver a shock to restore a normal heart rhythm. These devices can be life-saving for patients with serious arrhythmias. In conclusion, the treatment of heart rhythm disorders is highly individualized. It depends on the type of arrhythmia, the severity of symptoms, the patient's overall health, and their personal preferences. It's essential to have a thorough discussion with a healthcare provider to understand the benefits and risks of each option and to make an informed decision. While heart rhythm disorders can be concerning, effective treatments are available that can help control symptoms and reduce the risk of complications. Heart rhythm disorders, while common, can be serious health conditions. We've journeyed together through the intricate world of these disorders, and it's time to recap the key points we've learned. Firstly, we delved into the various types of heart rhythm disorders. We discovered that arrhythmias can strike in many forms, including tachycardia, bradycardia, and atrial fibrillation, each with its unique rhythm irregularities, and each capable of disrupting our heart's critical job of pumping blood throughout our bodies. We then explored the causes and symptoms of these disorders. We learned that heart disease, stress, caffeine, or genetic predisposition can trigger these rhythm disturbances. We also noted that symptoms can range from the barely noticeable, like a fluttering in the chest, to the more severe, such as dizziness or shortness of breath. Our journey then took us to the diagnostic process. We learned that detecting these disorders can involve a variety of tests, including electrocardiograms, Holter monitors, stress tests, and even advanced procedures like electrophysiology studies. The importance of accurate diagnosis cannot be overstated, as it paves the way for effective treatment. Speaking of treatment, we explored the many options available. From lifestyle changes and medications to more invasive methods like surgery or the implantation of devices like pacemakers, we saw that treatment is highly individualized. It depends on the type of disorder, its severity, and the patient's overall health. In conclusion, heart rhythm disorders are a complex and diverse group of conditions. They can pose a significant health risk, but with the right information, early detection, and appropriate treatment, they can be managed effectively. Remember, early detection and treatment of heart rhythm disorders can make a big difference. Stay informed, listen to your body, and don't hesitate to seek medical help if you suspect something is wrong.